More than ever, our health means everything. And when the need arises, the best healthcare facilities are closer than you think. A smooth medical journey from the Philippines to Singapore is now within reach. At the Patient Assistance Center operated by Parkway Hospitals Singapore, patients are provided with fuss-free access to quality healthcare. Located at the ground floor of Marco Polo Hotel in Ortigas Center, Pasig City, the Patient Assistance Center serves Filipino patients and their families who need support in medical and travel arrangements. The center connects Filipino patients to the world-class medical care and offshore medical treatment of Mount Elizabeth Hospital. Mount Elizabeth Hospital has been serving the Asia-Pacific for over 40 years as a medical hub in the Asia-Pacific region. Its strategic pairing of medical talent with revolutionary medical technology paved the way for its Joint Commission International Accreditation, the Gold Seal of Approval for Quality Healthcare. The one-stop shop concierge offers services such as medical referrals and appointment booking, evacuation and repatriation assistance, flight reservation, visa application and extension, accommodation arrangement, airport meet and greet service and domestic transfer arrangement, direct admission arrangement assistance before, during, and after hospitalization, multi-language translation and interpreter service, hospital billing and financial inquiries.
Singapore is a country that has a reputation for excellence, and this includes excellence in healthcare. Hospitals and medical centers there are globally esteemed for the exemplary service and modern facilities. Among them, Parkway Hospital Singapore is a group of 4 premium hospitals, and they provide world-class, top-notch medical experience. Philippine patients can now access the services, experience, and the medical expertise of Parkway Hospital Singapore through the Parkway Patient Assistance Center, or what we call PPAC, which is located and operated in the Philippines.
For the longest time, I wanted to get an appointment to Mount Elizabeth Hospital in Singapore, but I was uncertain who would be the best specialist for my needs. I am glad I discovered the concierge services of Parkway Hospital's Patient Assistance Center to provide the necessary support I need in my travel and medical arrangements. So I went to their office in Ortigas to inquire about diagnosis and treatment options. They then scheduled a telehealth consult, an online and instant connection from here to medical experts based in Singapore. I was referred to a specialist, and they even gave me the details of the number of similar cases handled by that doctor. If you don't want to stress over the process of acquiring a healthcare service in another country, give the Patient Assistance Center a call and let them do the rest for you. The caliber of their service is truly best in class.
Choosing the best healthcare really matters. Our team at Parkway Philippines is committed to serve. We look forward to the beginning of a fruitful health-centered partnership.
Whatever your health concern may be, access the wide spectrum of medical services of Mount Elizabeth Hospital Singapore through the Patient Assistance Center. We are here for you.
Good morning, everyone, and welcome to another edition of BusinessWorld Insights. Today's topic, understanding the matters of the human heart. In this session, presented in partnership with Mount Elizabeth Hospital Singapore, we'll be exploring the latest developments in managing and even preventing cardiovascular disease. My name is Tiago Renais. I'm the Chief Operating Officer of Health Tech Venture Builder Day 3 Innovations, as well as data analytics firm Fort Health Data Systems, and I'll be your moderator today. Whether it's unhealthy diets or smoking habits, various factors lead to the degradation of our hearts and our blood vessels, ultimately leading to the development of cardiovascular diseases. Now, according to the World Health Organization, an estimated 17.9 million people died due to cardiovascular diseases in 2019. That constituted 32% of global deaths that year. The disease remains to be the leading cause of deaths worldwide. But with the latest advances in health science and medical technologies, cardiovascular diseases are now much more manageable. And that's exactly what we'll be discussing today with our three expert cardiologists who I'll be introducing in just a moment. A quick reminder that we'll be selecting audience questions for our Q&A today, so be sure to jot down those questions as we hear from our panelists. So without further ado, allow me to introduce our three speakers leading today's discussion on understanding the matters of the human heart. Our first speaker is Dr. Chan Wan Sian. Dr. Chan is a senior consultant, cardiologist, echocardiologist, and heart failure intensivist at Mount Elizabeth Hospital. In 2001, Dr. Chan graduated with a Bachelor of Medicine and Surgery degree from the National University of Singapore and was admitted in 2006 as a member of the UK's Royal College of Physicians. She also completed various trainings in cardiology, cardiography, and women's heart health from several institutions in Singapore, Canada, and the United States. Dr. Chan was formerly the senior consultant and co-director of the Women's Heart Health Service at National University Heart Centre, Singapore, and is currently an adjunct assistant professor of the Department of Medicine at the National University of Singapore's Yong Lu Lin School of Medicine. Dr. Chan, thank you so much for joining us.
Hello, hi everyone. Thanks for inviting.
So we'll be hearing from Dr. Chan in a bit. Also joining us today is Dr. Stanley Chia. Dr. Chia is a senior consultant cardiologist and interventional cardiologist at Mount Elizabeth Hospital. Experienced in managing complex coronary artery disease and a variety of other cardiovascular diseases and conditions, Dr. Chia also handles difficult coronary interventional procedures such as left main disease, calcified lesions, and chronic total occlusions, which we'll be talking a bit about later. Dr. Chia was awarded the British Heart Foundation Scholarship Scheme and Junior Research Fellowship to undertake cardiovascular medicine research in a doctoral program that he undertook at the University of Edinburgh from 2000 to 2002. He completed his cardiology advanced specialty training at National Heart Centre Singapore and has been certified as a specialist in cardiology since 2006. Dr. Chia, thank you for joining us.
Good morning, everyone. It's truly a pleasure to be here today.
And rounding out today's panel is Dr. Edgar Tay. Dr. Tay is a senior consultant cardiologist and interventional cardiologist at Mount Elizabeth Novena Hospital. Dr. Tay graduated with a Bachelor of Medicine and Surgery degree from the National University of Singapore and was admitted as a member of the UK's Royal College of Physicians. He completed advanced training from the National University Heart Centre Singapore, the Royal Brompton Hospital in London, and St. Paul's Hospital in Vancouver. Dr. Tay was formerly a senior consultant and the director of the Structural Heart Disease Program at the National University Heart Centre Singapore, where he started the Transcatheter Aortic Valve Implantation Program, the MitraClip Mitral Valve Repair Program, the Percutaneous Pulmonary Valve Implantation Program, and the Balloon Pulmonary Angioplasty Program for chronic thromboembolic pulmonary hypertension. Dr. Tay, welcome to the session.
Thank you very much. Good morning to all of you.
Now, if we can have all our speakers on screen with me, I'll be directing questions to specific panelists. But if you have a quick comment or addition you'd like to add, any of the doctors here, please feel free to chime in. So I'd like to kick off today's conversation with a question for Dr. Tay. Dr. Tay, what basics should the public understand about heart diseases and complications? What kind of lifestyles contribute to one's susceptibility to cardiovascular disease?
So that's a great question. As you know, you've just mentioned about the high burden of cardiovascular disease in the world. And if you look at this slide, 1990 and 2019, several decades apart, and you can still see that the typical lifestyle challenges that we have can account for a lot of the problems that we have. So things like hypertension, high cholesterol, poor diets, smoking, all these remain the challenges that we face till today. We have very good medications, but certainly we still have to work on patients' ability to kind of understand the medications they're on, as well as to be participative in lifestyle-related improvements. And it's also important to know that even up to today, even though we have very excellent medications and technology, a significant proportion of patients still suffer from coronary artery disease or ischemic heart disease, as you can see from the chart on the right. About 50% of them have coronary artery blockages. But there are more diseases that we're aware of now. So it includes things like structural heart disease, valve disease, atrial fibrillation, or other kinds of arrhythmias. So we're getting better at identifying patients and offering them treatment.
Dr. Tay, just a quick follow-up, if you don't mind. How has COVID-19 and vaccinations influenced the cardiovascular field?
Yes, that's a very hot topic, as most of us are right in the middle of the pandemic now. And you can see from this slide that patients with cardiovascular disease are actually at a disadvantage. So if you see this 5 people, all in green, presumably all infected with COVID-19, if the patients have heart disease, they have a 4 times higher chance of falling off the cliff. So it's very important that these patients are identified early and continued or treated well. Because if we have cardiovascular disease, treating them well may actually improve their prognosis, especially in this pandemic. There are also some interesting issues about vaccines. As you know, vaccines are very effective in preventing hospitalization and severe illnesses. And there are some concerns, obviously, of things like myocarditis. But these are generally rare, and they can be picked up easily on clinical examination and on testing, and we can manage these side effects as well. But the rule is take your vaccines and it will protect you. So this slide actually shows what happens. A lot of people ask us about vaccine complications, which inflammation of the heart, like myocarditis, or inflammation of the lining of the heart called pericarditis. These can happen. It's about 2.5 per million shots for patients developing these kind of complications, but they can be detected easily and they can be managed as well.
Sorry about that. So Dr. Stanichi, I just want to throw this in your direction. What are the most important symptoms we should be watching out for when talking about cardiovascular diseases? What should we do when we experience these symptoms?
Right. So now, certainly, cardiovascular disease is a very broad spectrum. I think by far the most common cardiovascular disease is still down to coronary artery disease. And the most typical symptoms of coronary artery disease is what we call as stable angina. In other words, patients may feel chest discomfort. Usually we describe this as chest tightness, a constricting heavy sensation, more so in the chest, that may radiate down the arm and perhaps even up the neck. And this is typically precipitated by exertion, such as doing housework, climbing stairs, running, going up hills. And again, they may last for several minutes, and very typically it will be relieved and resolved by rest or the use of certain medication called glycerol trinitrate. Now, of course, there are also other symptoms. Some of the less typical symptoms, even of coronary artery disease, will be shortness of breath. And actually, in some patients, shortness of breath is the one and only symptoms that they present with. In other words, they just feel a drowning sensation or just a difficulty in getting enough air in. Some patients may feel that their effort tolerance, or in other words, their endurance has reduced. Some patients may get fainting spells, dizziness, or even confusion. And of course, if they have irregular heart rhythms, they may have a sense of palpitations, like your heart beating very quickly, slowly, irregular, or missing a beat. And for patients with heart failure, there may be fluid retention leading to swelling in the ankles or their lower limbs. Now, of course, for when patients come with these symptoms, they have to ask themselves, is this urgent? Certainly, is a very severe discomfort, chest tightness or shortness of breath that simply wouldn't go away, then of course they should go to the local hospital as soon as possible. But otherwise, if the patients feel that the symptoms get better or they resolve after some time, then there's certainly time for them to explore what the underlying condition is. So typically, I would advise all patients with any symptoms to consult a doctor. A doctor may do some simple tests as shown on this slide. They may do some simple blood tests, the tracing of the heart, or some simple running tests before they go for more sophisticated, perhaps non-invasive tests to determine the underlying problem.
Given the scale of this issue, it's heartening to know that there are practical steps mapped out already to respond to them. Now, Dr. Chan, we've seen amazing innovations in the healthcare industry these past few years. Can you give us a clear picture on the latest advancements in diagnosing heart conditions?
Okay, sure. Definitely, there's been quite a lot of advancement in terms of technology. So I'll first focus on imaging or scanning to assess the most common heart condition, which is coronary artery disease. What that means is that arteries in the heart, supplying blood flow to the heart, is being blocked. So in this area, next, traditionally, we use coronary angiogram, which is an invasive method. So that involves actually putting in a catheter, a tube into the blood vessel, usually through the artery, either in the arm or in the groin area. And then with injection of some radiation, some contrast material, we actually get to see the diagram below. You get to see whether the arteries are blocked or not, and then we can then do intervention. So that's the most traditional way of doing things. But lately, the last couple of years, we have seen really advances in CT scan technologies. And with that, now with reasonable and low radiation, with good quality machines, we are able to actually have pretty good high quality images for us to actually non-invasively, without having to put a tube into the person, to actually diagnose and look at the arteries of the heart to see how bad the blockage is next. And another aspect of coronary artery disease and looking at this condition is actually screening. So in people who have got some risk factors and high risk, we usually would typically do screening first. And typically, the past we used to do stress exercise treadmill. I think a lot of us have heard on that. Further, we sometimes pair and match that with an echo to look at blood circulation. And sometimes we do use this technique using nuclear material with an isotope to look at the blood circulation next. But again, with the advances now in CT scan, next please, in CT scan and MRI technology, we can actually now not just because sometimes echo and ultrasound, the image quality is not so good. So now we are using CT scan or even MRI technique to actually look at how well the blood is flowing in the heart muscle. So that gives us a sense of the risk in the patient. So we are now having more accuracy in terms of looking at patients' risk profile. Next. And another aspect in terms of imaging, scanning of patients is in the area of heart failure and structural heart disease. So traditionally, it would be on the left, an echo scan to look at the heart function, the structure of the heart. So besides the heart muscles in the heart, there's actually valves. And so that's the typical way. And now we actually have MRI technique, which we can actually, if you could see the diagram in the middle, we can actually now have better accuracy looking at the heart muscles, looking at the valve. So that diagram in the middle actually shows a huge tumor in one of the valves. So you can actually see it with very good accuracy and good image quality. At the same time, there's on the right side, cardiac PET scan. So this would allow us to actually also assess heart function with better accuracy as well. Thanks.
And Dr. Chan, beyond these fantastic advances in diagnosing and screening, what advancements have we seen in the management of these conditions?
So you come again, the management
of patients with, let's say, heart failure conditions.
Right. So heart failure has been a worldwide condition that is causing quite a lot of issues in terms of rising healthcare expenditure as well as survival. So people with heart failure, really, if you look at the graph on the right, has got much impact survival compared to the general population. Next. So in terms of heart failure, the main issue the main issue with heart failure actually it's hospitalization. So a lot of heart failure patients in their stable state on and off actually gets admitted. So this is where the issue comes in. It impairs quality of life of the patient, and also that's the main piece that actually cause issues, rise healthcare expenditure. Next. And besides hospitalization, there is a increased rate of rehospitalization in this group of patients. Next. So in the last, for many years, we actually do not have a breakthrough in terms of heart failure medications. So we do have quite a few medications for heart failure already in terms of improving symptoms and survival, but we haven't had a breakthrough for many years. But thank goodness the last 5 to 6 years, we actually have got these 2 medications. So 2014-15, we see the emergence of Entresto. So this medicine has been shown to really improve symptoms as well as hospitalization rate. It decreased hospitalization rate significantly. Now to the right, this is the last couple of years. We're seeing the emergence of SGLT2 inhibitors. This medicine not just improve in terms of hospitalization rate and symptoms, quality of life, it has been shown to improve survival. And the use of it now we know extends beyond heart failure patients. Next, besides medication, we are also looking at advances in the devices. So for heart failure patients, a lot of time, especially in the advanced stage, we can consider, there are of course certain criteria, we can consider cardiac rate synchronization therapy. It's actually a procedure where you insert, you could see wires both in the left and right side of the heart to synchronize the heart and improve heart function. So this has been shown to improve survival of the heart failure patients. And then next, recent couple of years, we have seen the emergence of mitral clip procedure. And this procedure is now in the guidelines, has been shown to improve symptoms and quality of life of a heart failure patient. And of course, in our clinic, Dr. Tay is someone who is really an expert in this field. And for people with advanced heart failure, in the past, where patients reach the end of the treatment strategies, we have really nothing else to offer but heart transplant. But unfortunately, heart transplant, there's quite a lot of limitation because of the limited supply of the organs. The last decade, 10 years, we have seen a great improvement in terms of ventricular assist device implantation. So on the left here that you could see, left down corner, this is a ventricular assist device. So what that means is it involves a surgery where you put in this pump. So this pump actually takes over the heart function. It draws blood from the heart that pumps back into the big artery for blood circulation. So in patients who are suitable for this procedure has honestly shown significant improvement in survival of this end-stage heart failure disease.
So I'd like to circle back to some of the specific procedures in a bit, but perhaps to nuance this conversation further, Dr. Chan, as the former co-director of the Women's Heart Health Service at NUHCS, how does treating heart conditions among women differ from treating them among men? What risk factors and preventative measures should women specifically be aware of?
Okay, we will first talk about the treatment of heart diseases in women first. Actually, the most common heart condition in women is still coronary artery disease, which is not different from men. But unfortunately, if you look at this slide here, we do see that for many years, even till now, women are getting less well treated in a way. They receive, even with the same conditions like heart attack and all that, they tend to receive treatment with medications as well as balloon and stenting procedure to unblock the arteries. They're much less done in women. Mixed, and therefore it results in a worse outcome. And from studies now, we know actually a lot of this it comes down to awareness among the women as well as even physicians. So a lot of so among the women and public as well as even our physicians, very few of us are aware, especially in the family physicians, that actually heart conditions are very common. In fact, it's the top killer of women. And a lot of people next actually focus more on the other aspect of health. Next, please. Yeah, so it's been in general a focus in women's health more on the reproductive system, like the ovary and the uterus issue, the reproductive organs disease, as well as breast condition like breast cancer, and so leading to this quantum begins approach to women's health. Next. And at the same time, there's an underrepresentation in women of women in treatment trials. Next. Yeah. So this actually leads to therefore under treating women in that sense. But of course, apart from coronary artery disease, women do have got heart conditions that are specific and more frequent or more specific in women. So for example, spontaneous coronary artery dissection. So that's where the heart arteries, where this is the coronary arteries, the arteries that supply, the blood vessels that supply blood into the heart. So unlike the common ones that we have described previously, where you see cholesterol plaque formation and causing a blockage, what happens is that the two layers, the wall in the wall of the blood vessels, actually there's a tear, and then there's a blood accumulation inside, and that's why it causes a blockage. So this condition is more common in women, and typically we see it during pregnancy. So this is one of the conditions that is more specific to women and actually requires a bit of a tweak and a difference in terms of treatment approach to this condition. The other condition is Takotsubo. So this is actually a heart failure condition where the heart gets weak suddenly, usually because of emotional stress or certain acute stress condition. Again, it's more common in women and requires a different approach to treating this heart failure. And for heart failure in pregnancy is a condition that we only see in women and usually occurs in the third trimester, towards the end, just before delivery or in the first few weeks after delivery. So all these are conditions that is more common or specific to women and definitely requires a different approach to management. Next. Yeah, so when it comes to risk factors, traditionally risk factors for heart conditions include diabetes, high blood pressure, high cholesterol, and lifestyles risk factors are actually very significant and often overlooked by most of us. So if you don't exercise, overweight, you smoke, this all puts us at risk. So this is the conventional or traditional ones. But now we recognize that actually there's emerging non-traditional cardiovascular risk factors that puts people at risk of heart condition. And if you look at the list on the right side, next, you look at the list on the right side, and it's not hard to understand that most of the risk factors here are related with women. So if you, in terms of pregnancy, if you have got diabetes, high blood pressure during pregnancy, preterm delivery, all this puts you at risk of heart conditions subsequently. So especially high blood pressure is one of the most common ones. It puts you at risk of developing heart condition even many years after pregnancy. And then for breast cancer, now we know that the medication used to treat breast cancer puts the heart at risk. So people tend to develop heart failure at risk of heart failure, and of course that is specific to women. And other things, autoimmune disease, depression, they are more common in women as well. Next. So what can we do in terms of preventive measures to improve the outcome in terms of heart disease for women? So first, I think, like I mentioned right at the beginning, is the awareness. We first need to improve awareness among the women and as well as physicians. So we recognize that women are at risk, get them to screen early, regularly for the risk factors that were mentioned. In terms of lifestyle, dietary, exercise, and we now know stress play a major part as well. So we could do some lifestyle modification in that aspect. And we screen them early, and once we diagnose any risk factors that we mentioned, especially diabetes, hypertension, we manage them well, make sure that they reach the optimal target. And of course, if there are symptoms that arise, we need to encourage the women to seek evaluation and treatment early.
So health promotion, that is education, continues to be a vital step, right? So debunking these long-held beliefs that cardiovascular health is really just a concern for men. Dr. Jan, maybe just last question, follow-up question, more concretely, what options do institutions like Mount Elizabeth Hospital extend to women managing heart conditions?
Right. So Mount Elizabeth Hospitals actually has recognized the fact that women there are conditions in terms of heart disease that's specific to women, and they have actually put in a lot of effort to do health promotion as well as exploring improving diagnostic options to try and diagnose and treat this the specific condition as far as possible. At the same time, we have a huge group of specialists here, including, because it's important we partner the obstetrician and gynae, and we do have got close relationship between the doctors where we can help to manage this problem.
Thank you for that. Moving to another pressing topic, we see a large number of patients with coronary artery disease experiencing chronic total occlusion. Dr. Chia, can you please explain what chronic total occlusion is, how it develops, how it affects the heart and the body?
Right. No, certainly. Again, chronic total occlusion refers to coronary artery disease. It's a certain spectrum. Now, again, to understand chronic total occlusion, we have to understand what is coronary artery disease and atherosclerosis. So as you can see as a slide here, on the left panel, that is a normal artery. But over time, the blood vessels in our heart, you may develop deposits of cholesterol, inflammatory cells, and gradually over time, we are talking about months and years, this may progress until it finally blocks up the artery, and then it restricts the blood flow to the heart. Perhaps I can show you a model here, if you can see here. So this, as you can see, is a normal artery where you have a clear lumen where blood can flow through. But with time, you may have this small yellow deposits around here, and that progressively gets worse and worse. And again, until one day, it may cause a very severe narrowing. So this is perhaps an 80-90% narrowing. But however, sometimes this can progress to 100% complete blockage. And when that happens, that is called a chronic total occlusion. Of course, if a blood vessel becomes completely blocked suddenly in the person, you will get a heart attack. You get severe chest pain and you have to rush to a hospital. But sometimes this can be a gradual process. So as the blood vessels becomes completely blocked, you develop small arteries around it to supply the muscle so that the person doesn't get a sudden heart attack. Now I'll show you on the next slide. This is a typical angiogram where on the left panel, rather than a straight path down the artery, where the arrow shows us multiple areas of blockage. It's like roadblocks, so blood can flow through nicely. Again, on the right panel, this is blood vessel on the right where the arrows will show that right at the beginning, at the middle part of the artery, it's completely blocked. So blood cannot flow through the artery. And in these kind of patients, they may experience chest discomfort, angina, shortness of breath, or even heart failure. So when this happens, the patients may present very similarly to those with coronary artery disease, where they may feel tired, breathless with exertion, and they may really feel that their lifestyle is limited.
Dr. Chia, what are the diagnostic procedures when it comes to chronic total occlusion? What tips a cardiologist like yourself off to these cases?
Yes, again, certainly I think if a patient has symptoms, if they go through some of the non-invasive tests like stress tests, it will certainly make us suspicious of underlying severe disease. But then, again, to clinch a diagnosis, it will be down to a CT scan followed by an angiogram as we showed before. And chronic total occlusion is estimated to occur in about 1 in 10 patients with underlying coronary artery disease. Now, the main challenge for these patients is that how do we deal with the problem? So let's say if a blockage is 70%, it's quite easy for us to unblock them, put a balloon, put a stent, unblock the artery. But in the past, chronic total occlusions are difficult, mainly because we can't cross the blockage. It's like a brick wall where you are stuck and we can't treat the patients. And very often, their only option is to either live with the symptoms or go for open heart surgery or bypass. But now, we'll show you the next slide. With better technique and better devices, we actually have very good options for our patients. So for example, the artery that I showed you before on the left side, where there are multiple roadblocks in the artery. Now through very specialized techniques with highly skilled operators and devices, you can see that we have cleared the path so the artery is restored and these patients' symptoms was completely resolved. And again, on the next slide, again, where the blood vessel was completely blocked in the mid segment. Again, these are the patients that we'll typically send to our surgical colleagues for an open heart surgery. But as the patient refused, and actually through a special technique where we not just try to open the artery from the front end, we also go from the back end, what we call a retrograde technique, a highly specialized technique, that finally we can actually restore the blood flow completely. On the right panel, as you can see, now is a nice big large artery so that blood can flow through nicely, the heart function improves, the symptoms are resolved, and the patient is very happy because he didn't have to go for a big surgery to restore his normal activity.
Amazing. Dr. Chia, what about intravascular lithotripsy? I understand this is a relatively new treatment on the market. How does this work to treat coronary artery disease?
Yes, certainly intravascular lithotripsy is quite a very interesting tool that we have had in the last couple of years. Now, lithotripsy, the idea is basically litho is like stone, you're blasting stones. And this is a typical technique used to blast kidney stones. For patients who are suffering from kidney stones, some doctors will offer you some ultrasound kind of blasting of the stones to to break up the stone. And this is actually the same concept. As you can see here, sometimes our arteries have calcium deposits that are hardened, just like kidney stones. So this is a device where we have a balloon that we pass across into the artery. Then it emits an electrical signal. It vaporizes the saline or the fluid that's within the body or within the balloon. And when this happens, this is transmitted into sonic pressure waves that goes into the artery to break up the hardened calcium in the artery. Now, again, to understand why this is useful, I'll show you the next slide. So what do we do with blockages in the heart? So these balloons and deposits. Usually, the typical treatment, we use a balloon, stretch open these blockage, open up the lumen, and thereafter, we place a stent, which is like a wire mesh on the right panel that you can see we insert in the artery to unblock the artery so that blood can flow through nicely. And on the next slide, you'll see a live case where on the right side, on the left panel, you have a tight blockage as shown by the arrow. But we can easily balloon it, and then we put a stent, and you can show on the other panel, and you see blood flow is restored. But this is only possible if the balloon can stretch open the artery. Sometimes the plugs that are in the heart, they are very hard. They are calcified like brick walls, and you simply have no way to unblock them. So this is where IVL, the intravascular lithotripsy, allow the doctor to do his job. On the next panel, on the next slide, you can see this is a patient that came to me with a tight blockage, about 70%. And we use a balloon at high pressure, and we simply cannot unblock it because it's so hard. So again, a couple of years ago, we may either have to consider more invasive strategies or bypass surgery for this patient. And on the second panel there, on number 2, you can see that we try to use a balloon, but there's kind of a dog bone effect. In other words, the balloon can't stretch the artery. But then we deploy the IVL. So this device, it delivered some pulse waves into artery, and it nicely cracked the calcium. And once that is done, the doctor can easily just slip in the stent, open up the artery, and then restore the blood flow and improve the symptoms for our patient. Again, this is a huge advancement in technology that allows us to treat our patients more safely and effectively.
So taking inspiration from other medical fields and bringing it into the cardiovascular, that's amazing. But Dr. Chia, aside from IVL, could you share some other recent developments in the diagnosis, treatment, and management of these diseases?
I think doctors together with scientists and engineers, we are constantly collaborating and coming up with ideas. So there are always a lot of devices. I think there's too numerous to explain that to allow the doctors to do their job. So again, some of the treatment, for example, we have the angiojet thrombectomy system, which has been refined over a couple of years, and together with other companies as well as Penumbra devices, essentially it's like a vacuum cleaner in the artery. So essentially, you put a catheter in there, and you can suck out the blood clot for patients who are having heart attacks. Sometimes there are patients at very high risk where they have heart failure, and even to try to do a procedure on them is too unsafe. So nowadays, we can actually put a device like what we call an impeller device. It's like a pump inside the heart, actually through the blood vessel without open heart surgery, just to support the heart function. And there are also other devices, such as the one called Stingray, that allows us to poke through the artery to allow us to unblock chronic total occlusion, or the diamond bag, which is another device which allows us to shave off the hardened calcium in the artery, all with the objective to allow us to unblock the artery to restore the blood flow so that the patient can have a much better quality of life.
Now, Dr. Tay, speaking of medical devices, I'd like to direct these next few questions to you as they fall right in your wheelhouse. Could you tell us about transcatheter valve intervention, specifically transcatheter aortic valve implantation? I think it's a TAVI. and mitral valve repair. Why are these procedures done, and which types of patients benefit most from these interventions?
Right. In the past 10 years, I think there's a big move towards therapies that are less invasive, and that's the key driver for some of these new technologies. So this is a picture of a patient with a heart valve condition called aortic stenosis. So essentially, stenosis means that the valves are hardened and they are unable to open well. So that means the heart, as it tries to pump, these valves can actually obstruct the flow of blood out of the heart. In the past, the patients had only one option, and that was to open the chest, remove the obstruction, and then sew in a new valve. But over the last decade, especially in the last 5 years, there's a big move towards this technique called TAVI, or transcatheter aortic valve implantation. So what this technology does is essentially mimics what we do for coronary artery blockages. So we actually put in a device that looks like a balloon that we use, and the balloon first goes into the valve, dilates and cracks open the valve, but we can't just dilate it with a balloon alone. Like the coronary arteries, we need to put in this metal or a stent to hold up the obstruction so it doesn't come back again. And also there are now valves sewn within the inside of these stents, which then start to work immediately. So in the video you see on the right, this is a situation where a TAVI valve is being deployed, and that opens up a channel for the heart to pump blood out much more easily. And this actually improves patients' symptoms. As you know, aortic stenosis, patients develop symptoms of chest pain or breathlessness. And once we open up this blockage, again, the patient's symptoms would be improved. So if we go on to the next slide, that again looks at a different problem. This is a patient with a mitral valve disease. Again, mitral valve is another valve inside the heart. And until only 5 to 10 years ago, there was no other option to treat these patients with a leaky heart valve. So these valves, when they close, they don't close tight enough. So there's a jet of blood that goes backwards instead of all going forwards. And that makes the heart strained. And patients who have these symptoms, have this condition, can develop shortness of breath, chest discomfort, or even heart failure. And again, by mimicking what the surgeons can do, the interventional engineers and the doctors have kind of devised a technique where we can put in a little device called a clip. And this clip actually goes into the heart from the veins of the thigh. And that allows us to direct a tiny clip to try to grasp the two leaflets of this valve to make it tighter and to enhance its ability to close well. And again, with this therapy, it has made life a lot easier for the patients because the patients don't have to have their chest cracked open, and typically they can go home much earlier after the procedure. So maybe we can move on to the...
Yeah, so I mean, these sound like pretty profound advancements, Dr. Tay. How has the development of these technologies improved procedures and interventional cardiology as a whole?
So as you know, these technologies, like what Stanley mentioned earlier in cardiovascular space, there isn't a day where engineers have stopped thinking. It's always thinking about what's tomorrow, what's better. And just last week, we have another update in the TAVI valves where a new skirt was put around the valve to make the valve a little more efficient, prevents problems of leaking, and actually enhances the outcomes of these patients. And similarly, the new iteration of the mitral valve clip is coming to Singapore in a couple of weeks. And this allows us to actually treat a lot more patients with different pathologies. So a lot of exciting things coming along the way because we have the engineers continuously innovate and think about the future.
So what can patients who undergo these procedures expect after undergoing TAVI or mitral valve repair?
Okay, so we mentioned a little bit about what happens after the procedure. Remember, we do these procedures for two main reasons. The first is to prolong life. So if you can see from the slides here, for both TAVI as well as mitral clip, they actually extend lives. So patients with these conditions, if they are left untreated, the prognosis is quite dismal in the sense patients get heart failure and the lifespan is actually shortened. So with these technologies, you can see significant improvements or extensions of longevity in the suitable patient cohort. So that's the first reason to prolong lives. The second reason you will see in the next slide is really to improve patients' quality of life. And this is critical, especially in patients who are suffering sometimes even months to years of heart failure or breathlessness. And you can see the the point of improvement actually starts off very early, 2 weeks to a month after the procedure. Patients already start feeling quite well. And in this chart, we call it a quality of life score. It remarkably increases significantly over 2 weeks. And it's not just the physical improvement of the patients, there's also emotional benefits and social benefits of this therapy. So it actually, in a complete sense, actually makes the patients not just feel better, but actually allow them to have much better quality.
Of the patients at Mount Elizabeth Hospital who've undergone these procedures, what was their experience like? How have their lives improved after these interventions?
Yeah, so when you treat these patients with the right therapies, you direct the treatment to the right problems, the patient's symptoms obviously improved. So patients who have, say, prior chest discomfort or dyspnea or breathlessness or inability to exercise, they would experience a significant improvement, and therefore lives are often changed. Even the carers themselves will have a big relief because they used to care a lot for these patients who are oftentimes have a lot of symptoms, and the carers themselves are obviously benefiting also from the fact that they see the joy in their relatives, and that really helps them as well. So finally, I would like to say that in Mount Elizabeth Hospital, what has improved is really the installation of this thing called the hybrid operating theatre. This is really a ability for us to do these to use these therapies in a very clean and sterile environment, because these valves that we implant in patients' hearts, we don't want to get bacteria on them. So this is done in a specialized room. We call it a hybrid operating room. So it has the ability to do surgery as well as to do these procedures. But what's most important is not just the hardware, obviously. It's really the software and the heart of the hospital, which is really the people. And many of these technologies, while they are great, really requires a whole team to look after the patient, get good results. So thank you very much.
Thank you for sharing that, Dr. Tay. I have a couple questions from the audience that I'd like to throw your way. These first few on the topic of heart disease. So this first one's for Dr. Chan. One of our participants asks, I have congestive heart failure and aortic valve regurgitation. What should I do to strengthen my heart? For context, I had chemo, ACT, and Herceptin for breast cancer 14 years ago. Dr. Chan, I think your mic is on mute.
There's a few risk factors in this scenario that we first got to pick up. First of all, the patient has got breast cancer 14 years ago. So sometimes depending on what kind of medication is being used, some of these medications can it results in heart failure even many years down the road. That's one thing. Second thing, the aortic regurgitation. What aortic regurgitation means is that one of this leaflet, this valve that controls direction of blood flow in this outflow tract of the heart. So the leaflets, we have to first assess whether there's structurally anything wrong with the leaflets. So what happens in aortic regurgitation is that the blood flows through and then keeps coming backwards and therefore causes heart failure. So if there's something structurally wrong with this valve leaflets, then there may need to be procedure or even surgery. So there's a few things that puts the heart at risk of this particular patient. So first got to assess this in these few angles first. And of course, the main approach in general, so for people with heart failure and if it's chemotherapy related, so there are medications, just like what we have shown previously for in terms of advancement and heart failure medications to improve symptoms, improve long-term outcome and of the patient. And in terms of aortic valve, I mentioned that if there's a need really structurally wrong, something wrong with the valves, then we do need to consider procedure surgery to repair the aortic valves or even do replacement. Yeah.
Thank you for that. Dr. Tay, this is a question from a participant who seems to be concerned about multiple concurrent conditions. They ask, are these three conditions dangerous in one person? Bicuspid aortic valve, MVP, that is mitral valve prolapse, and pulmonary hypertension.
Right, so these actually are three separate conditions. So I'll just briefly explain what these are. So bicuspid aortic valve is actually a congenital heart valve disease. Most of us in the aortic valve have 3 leaflets. Patients with bicuspid aortic valve have 2 leaflets. And in this particular condition, it happens 1 in about 100 patients. And what we see is that although the majority of patients are still okay with this valve, a small proportion of patients, as they get older, they may develop either valve leaking or valve stenosis, or the valve doesn't open well. So if the patient is doing well, has no symptoms, and on examination by the doctor there isn't a heart murmur, then typically the patients can be followed up and observed. But if they have a heart murmur or they're not feeling well, then certainly they need to look for a doctor to evaluate this a little further. The second condition is mitral valve prolapse. And this is again a kind of condition where the valve leaflets themselves are a little bit soft, and when they close, they actually bend a little bit. Again, occurs about 1 to 5% of patients. And what happens is that most patients are fine, but a small group of patients may develop leaking of these valves. And when they leak, they generate a sound which the family doctor often picks up, or they can actually develop even heart failure or breathlessness if they are not treated, and if the valve leaks significantly. And thirdly, pulmonary hypertension is really a condition where the lung pressures actually rise, and this is oftentimes related to sometimes heart valve disease or left heart disease. So if you look at these conditions in isolation, they could be it could not, maybe it didn't cause much problems to the patients, but these conditions actually can be a problem in some patients. And when they surface, patients again oftentimes will complain of symptoms of shortness of breath or chest discomfort, and certainly they need to be evaluated by their doctors or their cardiologists.
Dr. Chi, we actually have a couple questions coming in from the audience for you. First one is, how can my high blood pressure be controlled? It's currently in the 140s over 80. I developed this problem after I had COVID-19. What are the top 3 things a hypertensive can do to improve this condition?
Right. Now, for high blood pressure or hypertension, again, this is a common problem. Now, firstly, we always advise lifestyle changes. Again, in terms of lifestyle, exercise, weight loss, and a low-salt diet. So again, even before we consider further therapy, look at the patient in general. Is the patient overweight? Is he sleeping well enough? Is he very stressed? Again, see if there's any adjustment to lifestyle that can be achieved to lower the blood pressure. Again, if the blood pressure is still high in spite of all these measures, then of course medication is definitely indicated. So the key to the importance of medication is that we want to maintain that lower blood pressure. And we now recognize that if you have a blood pressure lower, let's say less than 130, less than 80 when you're at rest, then your long-term risk of heart failure and stroke, as well as heart disease, will be significantly lower. So I think do discuss with your doctor what kind of medication may best suit you, because there are different kinds of blood pressure medication that will be applicable to patients from different age groups and with different other risk factors. Now, as for the issue of COVID vaccination, well, it's true, it has been recognized that immediately after COVID vaccination, in some patients, they do develop slightly higher blood pressure. But again, this will gradually settle in the course of a few weeks and months and back to a baseline. The more important question that we have to ask is the patient already having borderline high blood pressure beforehand? If the blood pressure was high beforehand and then it gets exaggerated after vaccination, we'll still have to address the high blood pressure issue right before vaccination. So again, do keep a good blood pressure diary, and if it's persistently high, do this, adopt good lifestyle measures and discuss with your doctor on what medication will be suitable for you.
So speaking of lifestyle changes, on the topic of nutrition, this next question goes: what can be the substitute for nutrients that you would normally get from various fruits and vegetables if one cannot eat those fibrous fruits and vegetables?
Okay, now I think first of all you have to ask, why can't the person eat the fibrous fruit and vegetables? Of course, sometimes very fibrous food can cause a lot of gastric disturbances and digestion. So of course, in that case, I would suggest you just discuss with your dietitian. Are there other substitutes, things that are less fibrous, that may be more suited for you? However, if for patients who, for example, have difficulty swallowing, or they have a nasogastric tube where swallowing, basically eating food is not possible, then usually most of the nutrients can be found in many of the multivitamins or other commercially available supplements that are available in the market. So I would suggest discuss with your doctor or dietitian, first of all, what is the underlying problem preventing you from eating vegetables and fruits? And if you can eat them, maybe make adjustment. Different kinds of vegetables or less fibrous vegetables may be good. But otherwise, certainly we can have other kinds of supplements that can be ingested either in liquid form or in tablets.
This next question is for Dr. Chan. Question asker goes, I am a heart bypass patient. My procedure was done back in 2017. What kind of diagnostic test, perhaps like an MRI, should be done 5 years after a bypass?
Okay, usually couple of years after bypass. Okay, most of the time, really, we go according to symptoms. So if the patient is having symptoms or not having symptoms, if the patient doesn't have any symptoms, he's been quite well, then typically, actually, we don't really need an MRI scan, something that intends to check. So usually would be a screening. So we could actually use echo, which is an ultrasound-based method, simple, that doesn't have too much of side effects, just an ultrasound to look at the heart function, make sure that the heart is still functioning well. And depending, sometimes if there's risk profile factors like there's uncontrolled blood pressure or diabetes patient are at higher risk of getting issues again, then we may do some screening approach. And the screening approach most of the time can be just a simple stress test. So MRI comes in, I think, really in patients with symptoms. So of course, if you have got a bypass and 5 years down the road, there's some symptoms, we would need to do further evaluation. The first approach in this situation actually would be more a CT scan. So a CT scan now, I mentioned earlier on, acceptable radiation dose, the good quality, would actually allow us to assess the arteries of the heart and the bypass vessels conditions, whether there are any blockage that is building up. MRI comes in, yes, it does. If we do find significant issue on the CT scan, and there is a question whether the heart function, there is an issue with heart function, whether the heart muscle, because a lot of patients with artery blockage before, there can be injury on the muscles and the scar tissue. That's when MRI comes in to help us plan the next treatment strategy.
Fantastic. This question is for Dr. Chia. Has intravascular lithotripsy been done in the Philippines or perhaps in the region? And how successful is this procedure?
Yeah. Again, I'm not familiar with what has been done in the Philippines hospital, but I know certainly around Asia, lithotripsy IVR has been used quite widely. And it's generally a very successful tool. Now, just to understand what it's used for in the past, to break up all these calcium, we actually have a variety of devices, such as what we call rotablation drills or other more, let's say, higher risk devices to try to resolve the calcium issue. This IVR is basically a very simple tool that can be easily used by most cardiologists. All it involves is just placing a balloon there, press on a button, and then it starts delivering the pulse. Because of the simplicity and relatively low risk, it is widely adopted. Certainly, it's down to availability in the local hospital. It's easy to use and it's very effective. It's just a matter of how many pulses, how many electrical pulses are needed. And once you crack the calcium, basically the treatment is just like any other balloon and stenting procedure. It simplifies it a lot and it makes it so much safer for all our patients.
That really is amazing. So we still have time for each of our speakers to share their quick closing thoughts, but we are nearing the end of today's session. As we won't be able to address all the questions still coming in from our audience, our organizing team is making sure to note them all down so our speakers can reach out after today's event to share their insights. So that said, to those participants online, please feel free to keep sending in those questions and comments. Now, to formally close our session, I'd like to invite each of our panelists to share their closing thoughts. Perhaps we can start with Dr. Chan. We've spoken a lot today about all the new ways we can manage and prevent cardiovascular disease. Perhaps you can share a bit about how Mount Elizabeth is equipped to diagnose and treat this disease.
Right. So I think with regards to diagnosing and imaging approach and scans, the hospitals has really been taking and putting in a lot of effort in acquiring state-of-the-art imaging techniques like CT scan, MRI, that enables us cardiologists practicing here to be able to use and image patient to diagnose and therefore treat conditions accurately. When it comes to advanced heart failure, actually, there are many specialists in this hospital as well that we work closely with, because of course heart failure is a condition that a lot of time needs a lot of collaboration. So like the devices that we mentioned earlier on, cardiac resynchronization therapy, mitral clips, I think in our group, Dr. Jeremy Chow, who is an electrophysiologist, and Dr. Tay are very well equipped and expert in this field. For ventricular assist device, we work closely with our surgeons, cardiothoracic surgeons here, who are experts in this field as well. And we are able to work as a team to provide the latest and best treatment strategy for our heart failure patients.
Thank you, Dr. Chan. Dr. Chia?
Yes. Now, I think certainly, here in Singapore, here in Mount Elizabeth, I think we are all confident of our technical expertise, our services, our devices, the procedure. But more importantly, now we would like to focus is on the patient. We are confident that we can provide patients with a more holistic experience, because I believe that it's not just the technical expertise that we all have, but it's the mental, social, emotional well-being of the patient that we can focus on, that together we can get on this journey of health.
Thank you for that. Thank you very much. And Dr. Tay, you have the last word of the session.
Yeah, so I think, firstly, I'd like to thank all of you for joining us. And I think the most important thing is actually just to reach out to patients, educating everyone that it is important to be careful with our lifestyle, be aware of symptoms, not to push back and assume it's harmless. These symptoms of shortness of breath and chest pain may be something like a warning sign, and usually that should be evaluated. I think identifying disease early and treating them earlier, it remains the most important tool, as you know, prevention is so much better than cure. So with that, I'd like to thank you all again for joining us this time.
I think that's a fantastic reminder to end today's session with. So thank you again, Dr. Chan Wansian, Dr. Stanley Chia, and Dr. Edgar Tay. Such a pleasure having you on today's session.
Thank you.
Thank you.
And thank you as well to our partners, Asian Heart and Vascular Center, Bank Marketing Association of the Philippines, the British Chamber of Commerce of the Philippines, the European Chamber of Commerce of the Philippines, the Management Association of the Philippines, the Metropolitan Davao Medical Society, the Philippine Chamber of Commerce and Industry, the Philippine Franchise Association, and the Pharmaceutical and Healthcare Association of the Philippines. A huge thank you to the Freeman and the Philippine Star, our media partners, to Mount Elizabeth and BusinessWorld, of course, for having me on today's wonderful session. And of course, to our audience, please follow Mount Elizabeth's Facebook page for more information on how to treat or better prevent cardiovascular diseases. For inquiries, you can contact the Manila office of Parkway Hospital, Singapore. That's located at the ground floor of Marco Polo Hotel in Ortigas Center, Pasig City. And you can also reach them via email at manila.ph@parkwaypantai.com. That is parkwaypantai.com. Or via mobile at 0917-526-7576. And check out BusinessWorld social media pages for updates on more events like today's. Again, to everyone watching, wherever in the world you're tuning in from, my name is Tiago Arnaiz. Maraming salamat. Thank you very much. And we'll see you in the next session of BusinessWorld Insights. Stay safe, stay healthy.